Very good. Good to go. Good evening, everybody. This is another Friday, which we hope to manage to finish the whole talk. There's another time we started and things went haywire. But anyway, here we are again, trying to sit in the shoes of somebody called She Chooses to Live, who is an NGO, and trying to give people knowledge about various issues, especially reproductive health issues, but anything health, we are in a position to tackle, even if not ourselves, we can ask for help to tackle anything health. So we are more inclined towards reproductive health. She Chooses to Live is a platform that wants people to choose to live, to choose because they have knowledge. And in fact, the slogan of She Chooses to Live is because she knows. And with knowledge, one is able to prevent themselves from getting a lot of problems, especially sexually transmitted diseases and such things. So that's She Chooses to Live. So we are talking from that particular platform. To my left is my tech guy, Marion Wakahe, who makes sure that this thing is on air and keeps me there for a while and then removes me. And Dr. Jane Wakahe, I'm an obstetrician gynecologist of quite a number of years. And reproductive health really is my passion, not just because that's my job, but because I like women to know. And I've come to realize with time that if somebody knows something, they are more able to even if it's a very difficult situation, they are more able to handle it than if they don't know. So it's our hope that we are giving knowledge and that people are being able to utilize that knowledge to make informed choices that make a lot of differences in their lives. So the last time we were talking about gender-based violence, we've given one part one, and we were going to go to part two, which we didn't manage to go. So today we will tackle part two of gender-based violence. But just to recoup what the main points that we had talked about the very first time in gender-based violence is that 80% of all gender-based violence is sexual gender-based violence. So we are more concentrating on sexual gender-based violence because that's the more medical something that we have, and the more that is amenable to medical management. So we like I said, 80% of all gender-based violence is sexual. Very, very vital part of it. And it affects gender-based violence, whether sexual or not, affects all nations, all category of people, whatever their status of wealth or poverty, it affects everybody. Now, if we come to sexual gender-based violence, then I think the last thing I told us the last time is that please, if you've been a victim of this, do not blame yourself. Do not self-blame. It wasn't your fault. There is no category of woman or man that gets raped. It wasn't your fault. Just seek counseling, just seek support, and please do not make it your fault. Don't carry that guilt. There is enough to carry without also carrying the guilt. The second thing that I think I stressed that time is that 90% of the perpetrators, the people who do the gender-based violence, who give violence on the people, are known to the person. It's not a stranger. In fact, 90% you know who it is. It is only 10% that is a total stranger that does this violence. And it could be where does it happen? Maybe mainly at home. It could be in home. It could be you are in a date and you are in a certain home. It could be by a relative. It could be by an acquaintance. It could be people you know. So be aware that sexual violence can happen anytime, really anywhere. I also stress that children may not even know that anything is going wrong, and they may not know that they are being sexually abused. And it's up to mainly the mother. I stress more on the mother, mainly the mother or the female guardian, to make sure that there are no changing behavior on the child. If something starts to change, whether it's a boy or a girl, please try to investigate what it is that is causing these changes in behavior. I think I also told us that if you are gender-based violated, whether it's sexual or otherwise, do not base. Report yourself to hospital as quickly as possible. Kindly do not base. And even if you don't go like immediately, please make sure you arrive in hospital within 72 hours, especially of rape. Within 72 hours, otherwise you'll be told that there are some things that cannot be helped. So now let's come to part 2 of the gender-based violence. Now we have decided that it has happened. We know it has happened. Now we go to hospital. And in hospital, there are a few things that will be done and which you should expect to be done. And if they are not being done, kindly ask the person looking after you to if it is possible to do. So when one goes to hospital, there are three main areas of concern. One is the medical area, that anything medical could have gone wrong, and I'll go a bit deeper into that. The other one is the mental, emotional, just very emotional support that is needed. And the other one is long psychological support. All these are needed in sexual gender-based violence, indeed, all of them. Now, when it comes to medical, there are some pointers that we deal with. One is that we are trying very hard to manage any injuries that could have happened to the person, any physical injuries. Then we are trying to reduce the chance of somebody getting HIV or any other sexually transmitted infection from the sexual activity. And then we are trying to reduce the chances of pregnancy in girls and in women. And we are trying to protect them against tetanus, because that's one of the diseases that can be acquired when somebody is raped. So one goes to hospital, and in hospital you'll find that there is a very secure place, or should be a secure place, where people who have been sexually assaulted are interviewed by the medical personnel. It usually, even if the interviewer is a man, there usually be a female person inside the interviewing room, because people will want to feel safe when they are in the interviewing room. You will find that the person is kept in an area where there are not many people who can eavesdrop to what is being talked about, because this is indeed very sensitive, and it should be done in a private manner. So when all that has been taken care of, one has been put in a very safe place, in a secure place where they feel safe, then they are asked questions. The health personnel will guide you as to what questions they will ask you, questions to try to establish how big the problem is. So if there are no very major physical injuries, if there are life-threatening physical injuries, we deal with them before we even start stories of the history. But if there are no life-threatening injuries, then one will be asked a very, very detailed history. They'll be asked where this happened, when it happened, how many were there, what parts of the body were involved in all this. So there will be a lot of history. When it is a woman, she will be asked whether when her last menstrual period was. She'll also be asked whether she is on any contraception to determine whether she is on a safe contraceptive. And usually she'll also be asked how many children she has, because if she has had many children, then there could be trauma but not visible because she may not have been torn in the genitalia. So those are the history that somebody will be asked. And one should be requested to answer them as honestly as one can, because the medical personnel needs the history to be able to help. Now, when it is a child, it is actually very difficult because the child may not even be understanding what we are asking. The child may be also be so traumatized that they are not even aware of who is this stranger asking all kinds of questions. So the children need to be in a place with somebody who they can trust, with somebody who cares for them and who they can open up to as they are being asked the questions. And where children are concerned, medical personnel, they try not to rush them because it will take a long time to get history even out of them. Now, after taking a good history, then one has some examinations, some investigations that are done on themselves. So one of the things that is taken, especially from women, is urine. And what we are looking for in the urine is under the microscope, we check whether there is any sperm, actually in the spermatozoa in the microscope, and any abnormal white cells or any blood that is found in the urine. In the urine also, in a woman, they check the pregnancy test, whether a woman is pregnant or not. The second thing that will be taken now from everybody is whether adult or child or male or female is blood. And what we are looking for in the blood is we are establishing the HIV status. Then we are establishing what is called the hemoglobin, the oxygen carrying capacity. We are also looking at something called liver function tests. This is very vital because if somebody is found to be HIV negative and they will be given the medication that prevents HIV, this medication is very nasty on the liver. So we want to make sure that the liver is healthy, or even if it's not healthy, we want to make sure to see the state of the liver before the post-exposure, the medicine for preventing HIV is given. Then we will also check for syphilis. It is possible to check for hepatitis B. Hepatitis B is also sexually transmitted, and it is possible to check for hepatitis B. But routinely, we do not check for hepatitis B because the cost of checking for hepatitis B is more expensive, much, much more expensive than actually immunizing for hepatitis B. So we normally would just go ahead and immunize for hepatitis B. Now, the third thing that will be taken is a swab, what we call either they'll take a vaginal swab, they'll also take an anal swab. It is, if the mouth was involved, we'll also take a mouth, an oral, what we call an oral swab. These are very important in looking for any kind of sperm, especially sperm, but also more so for determining the the DNA of the person, so that finally the perpetrator could be determined that they were the ones with a positive DNA. Now, for it to be possible to harvest sperm, it is possible to harvest sperm either from the vagina or from the anus in 5 days, within 5 days of the occurrence happening. But this will not help somebody where HIV is concerned or where the pregnancy is concerned, but where DNA is required, then even if you were not able to go to hospital within the first 72 hours, you can still report within 5 days. And if there was sperm there, if the perpetrator was not using a protection of condom, if they ejaculated in there, then they will find that there is some sperm, and this can be analyzed by DNA, and they can decide who, if at all, the perpetrator was. So those investigations are done, and then we treat, like immediate treatment. So the first major treatment is to manage any physical injuries, like I said. This can sometimes be very severe, especially where the children are concerned. And sometimes, in fact, much of the time when it is children, we have to take them to the operating theater and put them under anesthesia to be able to repair those tears, those damages that have been done in their genital system, whether it is the anal or whether it is the young girl's vagina. So, but even for adult women, sometimes we have to go to theater because the tears may be very, very major indeed. So the first thing we do is look at the physical injuries and deal with them, whether in the outside theater or within theater. The next thing we do is we give a tetanus jab, a tetanus immunization to prevent against tetanus. We also give antibiotics to prevent against sexually transmitted infections. There's a time I talked about sexually transmitted infections, and we target many of the bacteria when we are giving this prevention medicine for sexually transmitted infections. We'll target gonorrhea, we'll target chlamydia, we'll target the other organisms that could be causing sexually transmitted disease. So it's a concoction of many medicines that one will be given to try to protect against sexually transmitted diseases. Now, we will have done a blood test. The other management will have done a blood test. And if somebody is HIV negative and they are within the first 72 hours, then we will give them what is called post-exposure prophylaxis. That is, we'll give them treatment to protect them against converting. If perchance the perpetrator was HIV positive, we'll give them treatment to stop them converting into themselves into HIV positive. If the blood work says that they are HIV positive already, then we will be more of counseling than giving what is called PEP. So, like I said, it is very vital to report to hospital within 72 hours, because after 72 hours, it is not possible to protect against HIV by post-exposure prophylaxis. Now, the next thing we shall do is we shall give a hepatitis B vaccine, unless somebody had been fully immunized against hepatitis B. If they have been fully immunized, then we will not give. But if they've been immunized, if they've not been immunized, then we shall give. If the next thing, if the pregnancy test in a girl shows that she is not pregnant, then we will give her the morning, what we call the morning after pill, the something to prevent her from getting pregnant. We will give her that one. or give her contraception or whatever it is to prevent her from getting pregnant because of the rape. We don't want a rape person unless, of course, they are on very, very good contraception, a contraception that is trustworthy, then we will not give. The other thing is that we will now consult a counselor. It is very vital that somebody who has been sexually abused or any other gender-based abuse gets counseling, because there is a lot of mental torture, mental trauma that happens, and somebody needs to be supported from the word go by counselor. Counseling is actually very, very key. And then finally, when all this is done, when one has had all the medications given and they've been cancelled, then they will kindly report to the police station. Some people report to the police station before they come to the hospital, but it's wiser to report to the hospital before you report to the police station. But whichever comes first, kindly report to the police station so that they can file the case and hopefully fight justice for whoever has been gender abused, whether sexually or whichever other way. There is follow-up, and this is very, very important. When somebody is sexually abused, it's not a one-off treatment. In fact, it is hardly enough. The one-off is a start treatment. There is very, very important follow-up, and please make sure you follow up as you are guided by the medical person. Now, the next follow-up after the initial treatment will be in 2 weeks' time. You will be requested to appear at the hospital in 2 weeks' time. At that time, the main thing is to make sure that you are taking your prophylaxis against HIV very, very well. It is not an easy medicine to take, so you want to be encouraged to take, and we want to check that you're actually taking it. The other thing is now they will check for sexually transmitted infections. 2 weeks later, if somebody got infected, say with chlamydia or with gonorrhea, or with even something like amoeba, there's the new variety of sexual infections that are happening, and Shigella, then we will be able to pick in 2 weeks' time. We will be able maybe to do a swab and pick and say whether it is there or not. So the main thing about 2 weeks is to make sure you're taking PEP properly. Come and report that you're taking your anti-HIV medicine properly. We check for any sexually transmitted infections, and if they're there, we treat them. And then again, there is counseling. Counseling in 2 weeks is vital. And if somebody doesn't actually go through counseling properly in gender-based violence, they will always have long-term effects about it. So it is very vital that one does that. The next appointment comes in 4 weeks' time. And in 4 weeks' time, what we are looking for is that you're actually completing your prophylaxis against HIV, that you've completed your 28 days. The medicine to protect against picking HIV is 28 days. So we want to confirm that you have finished your medicines and properly. We also want to test for pregnancy. If the pregnancy test was negative the first time, we want to reconfirm 4 weeks later. If there was a pregnancy starting, it will show that it is there. And then we will repeat the vaccination of tetanus, the second tetanus. The first tetanus we gave the first round. Then at 4 weeks' time, we shall repeat the second tetanus, and we shall also repeat the hepatitis B vaccine. So week 4, again, is very, very vital for somebody to appear for consultation. We'll also, even at week 4, check for sexually transmitted infections. that may be showing a bit later, and if necessary, again, treat them. At week 6, we check for sexually transmitted infection. And this time we specifically check for something called syphilis because it will show up 6 weeks after the initial infection. So we will check for syphilis at this particular time, 6 weeks. Then another counseling session will be arranged. Now, the next appointment comes in 3 months' time. And in 3 months' time, there are a few things that we shall do. We shall check, we shall repeat the HIV test. For those people who are negative HIV at the very beginning, we shall repeat it in 3 months' time. And if it's negative, then we declare that they have stayed negative. That's it. Then we will repeat a check for sexually transmitted infection, including syphilis. And there will be what is hopefully the final counseling. But counseling is not limited to 3 months. If the counselor feels that they still need to continue with the counseling, then they will indicate the same, and then they will continue, they'll give appointments. So how do we prevent gender-based violence, if it is possible? Like I said at the very beginning, gender-based violence is found in every culture, in every status of the country, whether poor or rich. And in every tribe, in every nation, indeed, you find gender-based violence. It is more marked, though, in where there is ignorance and where there is poverty. And in those areas, people will not be very open to go and report these violences. So how do we prevent it? One is to educate oneself that it is possible to actually be raped in the house. It's possible to be raped in a date. It is possible to be raped by an acquaintance. So educate oneself and share stories with people that things do happen indeed, and it's something to put at the forefront that it can actually happen. Now, we create, like what I'm doing now, creating social awareness. I keep saying this, which is true again, that this social awareness I'm creating to Princess Diana's, not to Wajiko. And I wish there was a way that I could create this awareness to the Wajikos. When COVID comes, we will physically go and create to Wajiko who do not have internet and who cannot get the ability to be online. So we are looking forward to the day that She Chooses to Live is able to go all over the counties and talk to young people, talk to old people, talk to men and women, and tell them that it is possible, or rather, even if not possible to totally prevent, it is possible to lower the abilities to be sexually or to be other gender-based violated. So again, I know I'm very much on the mothers' cases, and I will not leave mothers alone. Mothers, you need to know your children. You need to know them psychologically. You need to know their moods. You need to know when they're happy. You need to know when they're depressed. You need to know when they're eating well. You need to know when they are at peace. And the only way you can know this is create time to be with your children. Bathe them. When they're young, bathe them. Look at their anatomy. See if there are any changes that are happening in the anatomy. And if we prevent this from our children, we are doing a lot of good for our children. Now, I'll tell you two stories, that two actual things that happened when I was doing my public health. And this is very sad because a girl got raped by the uncle, and there was, the chief was involved and what have you, and they were to be taken to the police. But the family got together and decided that they can't do that because it's going to spoil the family name. And hence, they left it be. The man gave, the perpetrator gave something little to the family, which was slightly poor. But the main reason they gave is that it was going to spoil the family name. Now, can you imagine what it did to that girl, to trying to protect the family name, and what the perpetrator will do the next time because they've been able to get away with it. So the other story is, again, when I was still doing public health, a girl got raped by her stepfather. And I asked the mother why it is that they didn't take the case forward and why the man wasn't taken to the law. And the answer I got was, if we take him to court, what shall we eat? And again, that really hurt me. And these are real life situations. And again, coming back to the mothers now, finally, mothers. A long time ago, now this is not to do with public health, this is in my clinic. A number of years back, I treated a boy who was 6 years old, and I treated them of gonorrhea. And you know where it had come from? It had come from the house help that was left looking after the child. So mothers, be alert about who you are leaving your children to, whether it's boy child or girl child. Be alert who you are leaving your children to, and always make sure that your children are well, really taken care of. Even young boys will be considered, will be lured to having sex with older women. So kindly, mothers, take care of your children. I think I've talked too much today, and I've been very happy on the mothers, which I intended to be, because they are the base that holds a family together. And you're the only ones who can tell that your child is safe, that your child is in trouble, or that your child is not in trouble. So mothers, kindly get to know your children. And if nothing else, you've learned nothing else today, please go to hospital before 72 hours are over. That will help where pregnancy is concerned, where HIV is concerned. And do not forgive perpetrators because they are family. That is not, even the girl or the boy who has been sodomized is also family. Now I've finished talking about gender-based violence. The next time we shall be talking about another topic. You said the topics that you want to say, and now you can ask all the questions that you want to ask on gender-based violence. I'm about to call the tech guy back. Tech guy, so that we can look at the questions, if there are any. I'm not seeing any questions really. I think tech guy, she's a bit far. I finished. Yes, please. Hi, Evelyn. I can see you. They can see Millicent now. There are no questions. So this is where we get questions from. So if there are no questions, the main thing is to remember to go to hospital in time. remember to follow up the follow-ups so that you are able to not have long-term effects on yourself because of gender-based violence. And again, I repeat, do not self-blame. It is not your fault. There is no category of woman or child gets raped. There is nothing like that. If a perpetrator does it, it's because they meant to be mean. It's not because of you. Oh, our office number, we are based at the Nairobi Hospital Doctors Plaza, and our office number is 0721 938 208. 0721 938 208. That's it. Good. Finished. So we'll say bye-bye and see you hopefully next Friday on another topic. So, end.